Hi, I'm Garvin. This telecast is on Dolmatil. So what is Dolmatil used for? It's used for schizophrenia. And how does it work? So Dolmatil tablets contain the active ingredient, Sulpiride, which is a type of medicine called an antipsychotic. It is used to treat the psychiatric illness schizophrenia. Sulpiride works by blocking dopamine receptors in the brain. Dopamine is a natural compound called a neurotransmitter. These are chemicals that are stored in nerve cells and are involved in transmitting messages between the nerve cells. Dopamine is a neurotransmitter known to be involved in regulating mood and behaviour, amongst other things. So psychotic illness is considered to be caused by disturbances in the activity of neurotransmitters, or mainly dopamine in the brain. Schizophrenia is known to be associated with an overactivity of dopamine in the brain, and this may be associated with delusions and hallucinations that are a feature of this disease. Sulpiride works by blocking the receptors in the brain that dopamine acts on. This prevents the excessive activity of dopamine and helps to control schizophrenia. So people with schizophrenia may experience positive symptoms such as hallucinations, disturbances of thought and hostility, or negative symptoms such as lack of emotion and social isolation. Sulpiride is effective in relieving both positive and negative symptoms of schizophrenia. So how do you take them? Sulpiride tablets can be taken either with or without food. Sulpiride is usually taken twice a day, morning and evening. The dose that is prescribed will vary from person to person, so it is important to follow the instructions given to you by your doctor. If you forget to take a dose, take it as soon as you remember, unless it is nearly time for the next dose. In this case, just leave out the forgotten dose and take the next dose as usual. Don't take a double dose to make up for an earlier missed dose. For pregnancy and breastfeeding, the safety of this medicine during pregnancy has not been established. It is not recommended for use during pregnancy, particularly in the first and third trimesters, unless considered essential by your doctor. If the medicine is used during the third trimester, it could cause side effects or withdrawal symptoms in the baby after birth, and the baby may need extra monitoring because of this. If you think you could be pregnant while taking this medicine, it is important to consult your doctor straight away for advice. If you have been taking the medicine for long periods of time, you should not suddenly stop taking it unless your doctor tells you to, as this could cause your symptoms to come back. This medicine may pass into breast milk, as it could cause drowsiness and potentially other side effects in a nursing infant. It is recommended that women who need to take this medicine should not breastfeed while they're taking it. So the main side effects of Dolmatil would be restlessness and agitation, abnormal movements of the hands, legs, face, neck and tongue, or tremor, and twitching or rigidity, increased salivation, rhythmical involuntary movement of the tongue, face, mouth and jaw, which may sometimes be accompanied by involuntary movements of the arms and legs, difficulty sleeping or insomnia, and drowsiness, a drop in blood pressure or hypotension that may cause dizziness, interference with the body's temperature regulation. This is more common in elderly people and may cause heat stroke in very hot weather or hypothermia in very cold weather. Skin rashes, weight gain, high blood prolactin, which is milk-producing hormone. This level sometimes can lead to symptoms such as breast enlargement, production of milk and stopping of menstrual periods. Also, side effects would be sexual problems such as problems getting an erection, convulsions, irregular heartbeat or arrhythmias. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you're already taking to make sure that the combination is safe. So for antacids to treat indigestion and heartburn, and sucralfate can reduce the absorption of sulpiride from the gut. As this could make the sulpiride less effective, you should not take antacids or sucralfate at the same time of day as sulpiride. If you need to take these medicines, you should wait at least 2 hours after taking your dose of sulpiride. There may be an increased risk of drowsiness and sedation if sulpiride is taken with any of the following, which can also cause drowsiness: alcohol, barbiturates, the benzodiazepines such as diazepam, monoamine oxidase inhibitor antidepressants, sedating antihistamines such as Piriton, and sleeping tablets such as Zopiclone, strong opioid painkillers such as morphine, and tricyclic antidepressants such as amitriptyline. This medicine may enhance the blood pressure lowering effects of certain medicines used to treat high blood pressure. If you're taking medicines for high blood pressure, you should tell your doctor if you feel dizzy or faint after starting treatment with this medicine, as your blood pressure medicines may need adjusting. There may be an increased risk of extrapyramidal type side effects or abnormal body movements if this medicine is used in combination with lithium, metoclopramide, or tetrabenazine. Sulpiride may oppose the effect of levodopa and medicines for Parkinson's disease that work by stimulating dopamine receptors in the brain, for example, the pergoloid. Sulpiride may oppose the effect of anticonvulsant medicines used to treat epilepsy. There may be an increased chance of problems with your blood cells if sulpiride is taken in combination with other medicines that can affect your blood cells, for example, chemotherapy medicines. So if you have any questions on Dolmatil or anything else, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.